The U.S. Public Health Service launched a study to observe the natural history of untreated syphilis in black men, as if the phrase, "give the cure," were still buffering. Hundreds were recruited with promises of checkups, meals, and burial insurance. What they weren't given, once penicillin became the standard in the 1940s, was penicillin. Many were told they had bad blood, a catch-all that soothed worry while obscuring reality. Doctors drew blood, scheduled spinal taps, and charted symptoms as years turned to decades. Families kept asking when the help would start helping, while the project quietly prized clean data over living people. Power did the heavy lifting. Poverty, racism, and institutional authority all pressed down on the meaning of consent. Even when outside physicians tried to treat participants, gatekeepers sometimes intervened to preserve the observation. Nothing says science like locking the medicine cabinet so your chart stays tidy. In 1972, journalists exposed the study. Outrage detonated nationwide. Congressional hearings and lawsuits followed, culminating in a federal apology. Reforms hardened into infrastructure. Institutional review boards with teeth, stricter rules around vulnerable populations, and a definition of informed consent that is specific, voluntary, comprehensible, and revocable without penalty. The case became required reading not for any findings, but for the trust it destroyed and the guardrails it inspired. Communities remember, mistrust doesn't evaporate because a memo says, "our bad." Ethics isn't an accessory to research. It's the engine that keeps people human in the story.